Let's now look at workplace wellness programs, which can be important drivers of change in employee lifestyle factors and health risks. The behaviors that most significantly affect our health include poor diet, physical inactivity, smoking, lack of health screening, poor stress management, poor standard of care, insufficient sleep, and excessive alcohol consumption. These 8 behaviors directly lead to 15 costly chronic medical conditions. Careful planning is important to the success of workplace wellness programs. The Centers for Disease Control and Prevention suggest that the overall program plan should involve the systematic linking of multiple sources of data, ensuring confidentiality of employee information data, leveraging and building on existing activities with the goal of sustaining programs over time, diverse groups of individuals or organizations, multiple opportunities and methods for all employees to learn about and participate in the program's activities, and maintaining flexibility as needed. Here we see some of the factors that contribute to the success of workplace wellness programs. Successful programs are thoughtfully designed, accessible, sustainable, well-supported, with dedicated on-site staff, and they have relevant and varied offerings for the members. Shown here are some strategies that can be used to keep healthy employees healthy and at low risk, modify and/or reduce health risk factors, improve consumerism skills, and manage health conditions more effectively, especially chronic conditions. It's important to recognize that health risk is not static, and that without preventive programs to help individuals maintain their low-risk status, 2 to 4% of an employee population is likely to migrate from a low-risk to a higher-risk status within 1 year. According to the Kaiser Family Foundation and Health Research and Educational Trust 2013 Annual Employer Health Benefits Survey, 77% of employers that offer health benefits offer some type of wellness program. From the survey, we see that there are numerous offerings that employers are making available to their employees to try to improve their health. It includes health classes and coaching, weight loss programs, wellness letters, and smoking cessation programs, to name a few. While high levels of participation are critical to the success of a wellness program, results from the same survey indicates that most employers are not tying their wellness incentives to health outcomes. Your wellness program measures should inform you of how your program is doing. Basically, do they address the 4 R's: reach, retention, results, and return on investment? What percentage of the population is signing up? What percentage stays in the program? What performance outcomes are being measured? And what is the economic impact of the program? Employers are using several approaches to promote their wellness programs, as shown in this example from the Kaiser Family Foundation and Health Research and Educational Trust 2013 Annual Employer Health Benefits Survey. You can see here that personalized communication is the most common approach. Here we see some of the issues that can derail a program's efforts to reach as many employees as possible. No incentives. Although it's tempting to believe that good health is its own reward, that doesn't usually get most people to take action. Modern wellness programs attract the most people when incentives are involved. Misplaced incentives for participants. Incentives that are tied to participation can lead to short-term thinking, which means that some people will simply sign up to get an incentive. True behavior changes usually requires long-term work. Thus, it is important to align incentives with outcomes. The wrong communication channel. It's important to interact with participants through their preferred channel. While a personalized phone call from a nurse or a coach who is dedicated to helping you improve your health sounds great, this may not be ideal for a lot of busy, stressed out employees who already spend all day on the phone for their job. Consider surveying employees to determine their preference. Pull versus push of information. Pull models of coaching, which includes books, passive websites, and posters, can be great sources of information, but they require the employees to be motivated to seek the information. Most employees are busy. If they have 5 minutes of downtime between projects, they are generally more likely to get a quick news fix online. Thus, wellness programs benefit from providing information by email, text messages, Facebook, Twitter. Short-term thinking. Wellness programs are asking employees to adopt a new lifestyle. Thus, a 6-week contest or a 12-week boot camp is not usually the final solution. Consider letting employees know that the wellness activities they are participating in are a part of a multi-year campaign. Wrong motivation. Most people are not motivated by lectures from their physician. They usually just want to look and feel better. Programs are beginning to move beyond goals designed to motivate employees for medical reasons to ones that highlight how a program can help them reach the goals that are important to them. Considering wellness a team sport. For everyone that loves team-based approaches, there is usually someone who is sensitive about their health and would rather make it a personal journey. Wellness Corporate Solutions, a corporate wellness company, recently published a list of strategies that can increase employee participation in workplace wellness programs. This includes leading by example, making it easy, knowing what your employees actually want, branding and promoting your program, and remembering to keep it fresh, making it worth their while and making it personal. Others are exploring the process of using gaming elements to motivate and engage people in non-game contexts. Unlike most things concerning healthcare, games elicit interest and are fun. The beauty of a game is that it gives individuals a goal. Also, people tend to work longer and harder if an activity is game-based. Gaming is being used to make disease management fun. The first wave of disease management programs focused on changing people's behaviors to help them avoid chronic disease. This wasn't highly successful because people don't like being told what to do. The second wave of disease management programs focused on trying to make healthy behaviors more fun, such as adding a treadmill in front of a television. But that only works if the individual likes the specific task. Now, disease management programs are adding health to those things people already love to do. Examples of games to improve health include Wii Fit and Dance Town. Dance Town is a multiplayer video game for seniors designed to encourage exercise, improve coordination, and enhance cognition. Dance Town was based on Dance Dance Revolution, which was popular with teens in movie theaters and malls. Some of your vendor partners may provide gaming offerings. For example, Edna and MindBloom, a Seattle-based interactive media company, have collaborated to make the MindBloom Life Game available to all of Aetna's members as well as Aetna employees. MindBloom's Life Game relies on gamification to increase engagement. It blends the principles of behavioral science with social gaming to inspire people to live healthy, balanced lives. Each user has his or her own tree. The leaves reflect the different areas of life that are most important to them at the moment. Users create a simple action plan that helps give them the life they want, and they are able to track their daily progress toward behaviors that support their goals. Users can add inspirational items, including personal photos, music, and words. They can also get inspiration from friends, family, and the MindBloom community. Users can invite friends to join and share their progress via other social media sites, such as Facebook. This study examined the impact of a web-based personalized prevention plan on health risk in a cohort of 7,804 employees across multiple employers who were engaged in the plan for 2 years. The web-based personalized prevention plan identifies an individual's top health risk and designs a customized step-by-step plan to reduce those risks. The plan leverages social cognitive concepts such as efficacy building and self-regulatory mechanisms like goal setting and self-monitoring to facilitate health behavior change. To develop the customized plan, individuals completed a health risk appraisal and agreed to biometric reporting and laboratory testing. Top health risks were identified, and each individual was provided with a step-by-step recommendations to lower health risk and prevent health conditions from developing. All participants were given support to adopt healthy behaviors and lifestyle changes. Users determined the level of engagement they wanted. This ranged from just completing the health risk appraisal to live coaching to virtual coaching and to the participation in social challenges. Of those who started in a high-risk category at baseline, 46% moved down to medium risk and 19% moved down to low risk after 2 years on the prevention plan. 23% of individuals reduced their health risks by just engaging in the web-based technology. The same study also looked at the results by their level of engagement. In stage 1, engagement was informational in nature and included the completion of a health risk assessment and laboratory testing. Website access provided basic health-related information as well as a description of identified health risk and targeted messaging suggesting actions to reduce risk. In stage 2, engagement was defined as virtual, social, or both types of engagement and was composed of completing one or more virtual coaching action programs, social challenges, or both. Virtual coaching was accomplished through completion of self-directed activities, automated messaging, and targeted reminders. Social engagement was through the use of group challenges aimed at physical activity or health eating to track their progress and provide online comments of support to their teammates, as well as observe their ranking compared with other teams. In stage 3, engagement included live coaching interactions with or without virtual and social engagement. You can see that the greater the level of engagement, the greater the level of health risk reduction. There was an 18% reduction in health risk for individuals who only engaged in the program at the most basic level, compared to a 30% reduction in health risk among individuals who used coaching combined with virtual and social activities.